Welcome to the Orthopedics Unit, a specialty that is near and dear to my heart because looking back, I was baptized by fire as a new grad. As a student, I did two ortho cases, and my first job was the quote-unquote ortho princess, trained to replace the ortho queen who was electively choosing to leave the workforce. Moral of the story, with a can-do attitude, you'll always be able to learn new things, no matter how uncomfortable it may make you feel at first. All right, so orthopedics, big unit. I definitely recommend that you take it in small bites so you don't get overwhelmed, okay? The first thing we need to realize is that orthopedics focuses on disease, anomalies, or injury to bones. Orthopedics is not solely devoted to the bones in the body, however, it also includes the tendons, ligaments, joints, and muscles of the body as well. Your TED Ed video this week is devoted to tendons, ligaments, and joints because those areas can be easily mixed up. If you're a little rusty on your bones and muscles, I recommend you play around on two fun websites called Whack-A-Bone and Poke-A-Muscle. I have added them to the bookmarks portion of your 202 course, and you'll find them under bookmarks on the resources page. Knowing what makes up this orthopedic specialty then leads us to want to know why our musculoskeletal system is so important to our bodies. It is so very important because it supports the body. The bones of our body produce red blood cells, they store calcium for metabolism, protect our organs, and allow us to move. Tendons attach muscles to bone, and ligaments attach bone to bone. I don't really have any nifty mnemonic devices for you, but I definitely remember that when I was a student, I always remembered ligaments because of the ACL, the anterior cruciate ligament. And the reason being is I knew that my knee had two bones and that my ligament kept my bones stable. I knew that the ACL kept your knee stable, and therefore the L in ACL was ligament, and there were two bones in my knee, therefore ligament attached bone to bone. So if that helps you, great. Okay. On your first official slide, you'll recall from your reading that the skeleton is divided into two parts. Those two parts are the axial skeleton and the appendicular skeleton. Make sure you know what bones make up the two parts of that skeleton. Take a moment to refresh your A&P knowledge and think about the vertebra and the ribs. How many vertebrae make up the vertebral column? What are the 5 components of the complete human spine? Which ones move? Which ones don't? How many bones make up those sections? How many ribs do we have? What is the specific cartilage that belongs to the ribs? Back to your slide. Your bones are made up of 2 components. The cortical bone is compact and hard and is found on the surface of the bones. That is important when you're scrubbing because you will come into contact first with cortical bone unless you're dealing with a fracture. The other component of the bone is cancellous, or spongy bone, which is found on the ends of bones and in the inner layer. Refer to your textbook to remember what is found in that cancellous layer and which bones are responsible for making new blood cells. It's important for you to know that for bone grafting purposes, the bone tissue that will be harvested will be cancellous because it has the cells needed for bone growth. On your next slide, we will continue talking about bone tissue with emphasis on the medullary canal. The medullary canal is the centralmost portion, or cavity, of bone shafts. So for long bones, the order of tissue from outside to inside is cortical bone, cancellous bone, medullary canal, cancellous bone, to cortical bone, and that is through and through the shaft of a long bone. Red marrow is found in the small spaces of cancellous bone and is highly vascular, while yellow marrow consists mostly of fat cells and connective tissue and is in the medullary canal. If you get an opportunity to observe or scrub a total knee procedure that uses bone marrow autograft instead of bone cement, you'll see exactly what I'm talking about. So next, I want you to recall what you already know and write down which type of bone marrow produces blood cells and hemoglobin and where is it found. On this slide, you'll see a different anatomical components of the long bone. Attached to the cortical layer of bone is a protective covering called periosteum. Periosteum, like I just said, is protective, and it is what tendons attach themselves to. And what do tendons attach? The periosteum consists of a dense external layer that contains blood vessels and an inner layer of connective tissue. That sounds like something one might want to preserve, but in actuality it has to be scraped away from the surface before surgery can be performed on the bone. This is particularly evident in fractures and is an important step of the procedure. It is accomplished with a periosteal elevator. There are many periosteal elevators that are used for this task, and they are selected based on the size of the area they are being used. They range from elevators as small as the Freer elevator used in the metacarpals and wrist to very large, like the Cobb on the femur. Look up the Freer and look up the Cobb in your instrument book, and I'll bring some to class for you to look at and practice passing. So periosteum is on the outside, endosteum is going to be on the inside, and it is the inner lining of the channels of long bones, and it fills the interstitial spaces, the sponge-like space, of cancellous bone. The endosteum initiates bone growth and provides nutritional substances to the bone. The periosteum contains the specialized cells that secrete the matrix for bones to actually grow. It's also important to note the structure and shape of bones is important. This next bit of information noted on the sectional portion of the picture on your slide here. Whoop. Long bones, in addition to the medullary canal and the production of blood cells, are also characterized by a diaphysis and an epiphysis. Note on your picture the diaphysis is in the middle while the epiphysis is on each end. The epiphysis is where the cartilage is located, and that's extremely important in joint anatomy. And the transition between diaphysis to epiphysis is extremely important in fracture pathology because that's where growing bones in children and adolescents are actually growing. Fractures through what is called the epiphyseal plate will complicate the reduction of the fracture because you can't just plate and screw the growth plate. Also, there's potential for growth of the bone to be affected. These are all perioperative considerations made mostly by the orthopedic surgeon, but eventually you will be able to anticipate these considerations and be that much more prepared for your cases. Obviously, not every bone is a long bone. Some are short, some are irregular, some are flat. Your book is very kind and gives you examples of all of them, and I recommend that you study those different bones as well. I'll pause the video now and we will continue in just a moment.